Hello everyone, I am Dr. Sumit. I am a urologist based in Gurugram. Today I am going to talk about a very common but least talked about problem, which is premature ejaculation in men. Premature ejaculation means that the person, while engaging in sexual intercourse, either ejaculates before penetrating or immediately after penetrating, the ejaculation happens without any control of the individual. This is a very common problem, but people out of shame or out of embarrassment, they usually do not talk about it. So what can be the reasons for premature ejaculation? The threshold for ejaculation of every individual is different. This threshold at which ejaculation happens, however, it can be adjusted to some extent. Whenever an individual he starts having intercourse for the first time, because of excessive excitement, it is very difficult to control ejaculation and the ejaculation might be very prompt. However, when an individual engages in an intercourse on a more regular basis, the threshold for ejaculation it goes up, the sensitivity it decreases, and it might be possible for the person to be able to perform better over time. So if you have engaged in sexual intercourse for the first time, and if the ejaculation has happened too soon, then there is no need to worry. It is not uncommon, and over time the condition might improve on its own. However, premature ejaculation can be an indicator of some hormonal imbalance in the body, and it can be an indicator of the fact that the individual is not taking care of his health very well. So if that is a common occurrence with you, please exercise very regularly. Stop smoking, stop crystalline sugar as much as you can, have a platter of raw salad, vegetables, and a glass of a juice which is very rich in antioxidants like beetroot, carrot, pomegranate juice on a very regular basis. Decrease your salt intake. Control your weight, because if your body fat is more, there is more likelihood that you might have some hormonal imbalance and the performance may be suboptimal. These are the organic measures to better your performance. However, there are certain other physical, mental, pharmacological as well as surgical methods by means of which the sexual performance it can improve and the ejaculation can be delayed. If we talk about physical methods, there are 3 of them that one can adopt while having intercourse so that the ejaculation can be delayed. Number 1, while having intercourse, don't squeeze or contract your pelvic muscles too hard. Relax the pelvic muscles while having intercourse. If you squeeze your pelvic muscles too hard while having sex, the ejaculation will be very prompt. But however, if you leave the pelvic muscles slightly loose, the ejaculation can be delayed for some time. If while having intercourse, you feel that ejaculation is about to happen, you should stop stroking. Take a break. Maybe withdraw the penis, engage in foreplay again, and then restart once you feel that the sensitivity or the immediate urge to ejaculation has gone away. If you think that now the ejaculation is not under your control while having intercourse, the person might squeeze the tip of the penis or the cap of the penis hard and keep it squeezed for a few seconds. By doing this, irresistible urge to ejaculate that was there, it goes away in 50% of the cases. If you have been able to prevent ejaculation by squeezing, then you should engage in foreplay again and then restart. These are certain physical methods one might adopt to delay the ejaculation. The mental method which one might adopt to delay the ejaculation is called diversion. In this, while having intercourse, one has to divert his mind. The most effective way to divert your mind is, while having intercourse, do some sort of mathematical calculation in your mind so that the mind is not into sex. So for this, the common advice that I give is that one should do some mathematical calculation, like select a random number in your mind and then sequentially subtract 7 from that number. For example, the number that you have chosen, say, is around 250. Then Subtract 7 from 250, it will be 243. Then subtract 7 from 243, it will be 236. Subtract 7 from 236, it will be 229. So if your mind is not completely into this mental calculation, you will not be able to do this calculation accurately. This method is called diversion. The third method that one can adopt is pharmacological method. You need support of a doctor, a specialist for this, and the doctor might prescribe you certain medication. These medication work at a mental level and decrease this excitement in the mind so that one is able to have intercourse for a slightly longer time. There are certain local sprays also available which when sprayed on the head of the penis, it decreases the sensitivity of the penis. The fourth and the least commonly adopted method, however, a very successful method is surgical intervention, in which a small surgery is done on the penis and we decrease the number of nerves supplying the penis, the sensitivity of the penis to tactile or touch stimulation. It is decreased by adopting this surgery, and one might be able to have intercourse for a slightly longer time. I hope this helps the listeners to improve their performance. Thank you.